My community plan. The community that is being taken into account in this investigation is North Bergen, New Jersey. North Bergen, New Jersey is a town located in Hudson County in New Jersey. The community borders Karlstad and Hackensack River and is found in the north of Secaucus, and Gothenburg borders the community on the west. This presentation focuses on the determination of the health issue being faced by the community and present interventions necessary. The process of provision of healthcare services in a community is critical, and the healthcare providers are supposed to have an understanding of the community for them to offer reliable services. With an understanding of the community, there is an ease in the satisfying of the people in the community. Samson, Giren, and Bo 215 adduce that community assessment is the process that is carried out for the listing of the assets, the challenges, and advantages that are seen in the community. The survey of the organization indicates that there is a safe care for the children as evident from the care being provided by the older adults. In the community as well, there are religious organizations that distributed in the community. The people living in the community are mostly involved in small businesses. The schools that are provided in the community are supposed to help in the provision of reliable education, and the quality of the school is good. There are community organizations including the UCP of Hudson County and the North Hudson Community Action. The collection of information will be fundamentally for the process of decision making. This is attributed to the fact that with reliable information, one can be able to make the correct deductions. There is as well a reliable process being followed in the development for the data sources in using information technology, and the data sources can be obtained from the members of the community. As such, interviews of the people in the community can be carried. There will be a need for the development of understanding of the issue that is found in the community, and the healthcare providers will play a critical role in ensuring that success is attained. Typically, the process of communication will be important, but there will be a need for the healthcare providers to help in the support of the success to be attained. The process will be attained only if there are resources for the development of the intervention. The community resources and partners will include the online resources and the human resources leaders. To allow for the diagnosis, it is important that a strategy is put in place to help in ascertaining the role of the leaders in the management of the health standard of the people. Considering this, there is an ease in the process of provision of the healthcare standard processes that will in turn ensure that there will be an education process to inform the people of the healthcare challenges being faced. The management of the challenge of the obesity in the community can be attained by ensuring that the people in the community are regularly educated on the issue of obesity and the strategies of managing or evading the issue. In this regard, it is important to point out that as a result of the challenges that are faced by the community, including issues of poverty, it is important that the leader intervenes in developing policies to help in the management of the kind of meals that are taken by the youth. The issues that has been seen in the community is the rise in the issue of obesity. As argued by Conway et al. 2018, this has resulted in a continuous deterioration in the standard of health of the people living in the community. The process of education should be carried out with the idea of having a considerable support from the community members. The education is expected to help in the elimination of the cases of risks such as the meals being taken. The process of education of the patients and the people living in the community will have impact in ensuring that the process of communication is easier. The process of education of the people living in a community is expected to help in the support of the knowledge of the community and the challenges of risks. The parents are as well supposed to be education on the issue of obesity and get to know the measures that needs to be taken to eliminate the cases of obesity. The other proposed interventions for the community to eliminate cases of obesity is to have a policy. This policy will act as a guide for the process of evasion of the issue of obesity in the community. This policy is expected to help in the elimination of the patient care issues. Typically, the policy will be important for the determination of the necessary exercises activities. The process of evaluation of the intervention proposed is important since it allows for the changes to be made in the case that this was necessary. The process of evaluation will be carried out with the intention of ascertaining the success that is seen in reducing the cases of obesity in the community. The evaluation will be seen by assessing the changes in the number of cases of obesity after the implementation of the intervention. In conclusion, the community being considered is North Bergen, New Jersey. The issue of obesity has been challenging in the community for the past many years. The proposed intervention is to have an education process for the people. The other proposed intervention is to have a reliable policy. The evaluation of the intervention will be seen by assessing the success in changing the cases of obesity in the community.